Hi friends! Welcome to my channel. It's Heather Rhenee. If you are new to this channel, thank you for coming. I hope that you hit that notification bell, subscribe, like, comment, and enjoy the content that we're having. And if you're returning, what's up? This channel is about discussing infertility, IVF, NICU life, and everything in between. They're all things that I've experienced. I'm just hoping to make a community, a community for us, something that I wish I had when I was experiencing and am experiencing those things in real time. You all, that's my 1-year-old in the background. He's obviously tickled about something. I'm not quite sure what, but you will often hear him in most of my videos, but he's okay. He's just living his best life. To go ahead and get started, I have a couple of episodes already regarding infertility. If you haven't watched those, please go back and watch them. They're really informative. I try to make my videos as short as possible, but still with all the information that I know will be helpful that you need. But go back and watch them. I am going to segue into my IVF series. But before I deep dive into the IVF talk, I wanted to close out this particular segment of the infertility series with types of treatments that some people pursue when seeking to treat their infertility. IVF is not the only option that people use. Does this mean that I'm not going to talk about infertility anymore? No. There will be more discussion on infertility at later dates, and hopefully I can begin to start sharing your stories too. I haven't got any emails from anyone yet, but I will make sure I put my email in the description box so that you can email me your stories if you want to talk about it. Maybe one day we can go live or, virtual recording. It would be super cool. But yeah, I want to talk about the popular approaches that individuals take and that couples take to address their infertility. First and foremost, the most frequently suggested thing that doctors and medical professionals suggest is lifestyle changes. I know that you all are probably sick of me talking about the same old things when it comes to lifestyle changes, but it's just facts. Being healthier, moving your body around more, exercising more, making sure you're a healthy weight, whether that's not overweight, not underweight. Making sure that you're not excessively drinking. Make sure that you're not excessively smoking or doing illicit drugs. Yes, it affects women as well as men. It can make men's sperm count super low. It can make their sperm very deformative. So it's not just regarding women. It's not just regarding men. It's regarding everyone. Lifestyle as a whole. Get that together. It's the main thing. And it's really just adjusting your diet and managing your stress. Like I told you in other videos, watch your environment, the people that you allow around yourself, having a healthy relationship with your partner, having more orgasms to release that happy hormone. And all of these things can help maximize the success of contraception. Also, tracking your ovulation, as I discussed in a previous video, using that ovulation kit. Very, very, very important that you use the right tracking things to help. That's the easiest infertility treatment that you can try. Minimal cost and primarily lifestyle adjustments. And usually your medical provider will suggest this first. The next type of procedure that people try, ovulation indication. And basically this is with oral medications like clomiphene citrate. And basically there are pills that you take and it's monitored by a healthcare provider. All of these things are monitored by your healthcare provider, whether you're at a fertility clinic or with your OBGYN. It has to be monitored in order for it to be as successful as possible. You'll take these medicines and they stimulate ovulation through oral medications, and it increases the chance of egg release. Now, remember, I discussed ovulation is the most important phase of the menstruation cycle, and that's basically when your mature egg releases and in hopes that it's successful and it implants into the uterine wall, becomes a little baby. That medicine helps control ovulation. And typically this is the first step that women with disorders like PCOS or women who don't ovulate, yes, some women some women don't ovulate, and women who have irregular menstrual cycles. This is the most commonly used treatment for women with those kinds of disorders, and you usually try it on and off for a certain period of time, whatever your provider evaluates and says is the best amount of time that they want you to try it. This is also another form of treatment that is used for people who have unexplained infertility, because not everybody who has infertility has a diagnosis. And I think not having a diagnosis can be really, really hard because you can't do as much research as you can do with all the other things. But this would be the second most suggested treatment that a couple or individual could try when treating infertility. Overall, OI treatment is really non-invasive, and it's a really affordable option for women who have, ovulation disorders in order to improve their chances of conceiving. Now, there is around like a 20 to 25% success rate with this particular procedure or particular treatment, and that's per cycle. And the average cost is usually about $100 to $500 per cycle. The next type of treatment that could be suggested is something called IUI. That stands for intrauterine insemination. I actually did 2 of those. I will get more into detail about it in another video, but basically an IUI is kind of done along with OI. So they give you medications to control and stimulate ovulation while the woman is taking the medications to control that. The man is making sure that he's eating healthy and not drinking and not stressing and blah, 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 like I said in the other videos, because his semen is taken on the day of the procedure. And once the semen is collected fresh, semen is always collected fresh. I don't know why I said fresh, but once the semen is freshly collected, they separate the sperm from the rest of the substance that makes up the semen. As I've stated before, sperm is a small percentage of all the sugars and all the junk that is mixed in with the semen. The stuff that is Jet shaking my camera. Jet, the stuff that you see and that you think is sperm is not sperm. Jet. With IUI, which is typically done with OI, they take the man's semen, they wash it, or like I was just mentioning, they separate the sperm from the semen, and they make sure that the woman's body is at an ideal time of ovulation, the perfect timing, so that once they collect the sperm, they can go ahead and allow the woman to come in for it's like a day procedure. You're not put under any anesthesia that'll put you to sleep. It's more so under some type of anesthesia to help with anxiety and help with comfort, and so you won't feel any pain. It's not a painful procedure, but they're in there putting a little catheter in there to put the sperm in the most ideal spot so that they can travel and reach the area that they're supposed to, so that we get a little embryo that can attach to the uterine lining. And the catheter that they use, people who've never used a catheter, imagine a coffee straw. It's like thin like a coffee straw, and they stick it into your vagina and back into your uterus, and then they inject the fresh sperm in there with the hopes of it doing what it's supposed to do. After the procedure, you have to lie still for a little bit because they don't want you jacking anything up. And once you lay there for a little bit, they let you go. Now, some people, they suggest to take progesterone throughout this thing. So progesterone is important. As mentioned, is one of our top hormones in the menstruation cycle. And it's important because it prepares the uterine lining for embryo implementation. And it helps to maintain pregnancy in the early stages. So some women, once they have the IUI or whatever procedure that they have, they continue to take progesterone as one of their medications to help support that. And some women, which I think all, should be instructed to avoid strenuous activities and sexual intercourse for a brief period of time, maybe from a few days to a couple of weeks, at least until it is determined on whether or not the egg was fertilized. Because when you have intercourse or strenuous activity, they're not just telling you that to be party poopers. That kind of stuff can increase blood flow to the pelvic area, and that can lead to discomfort in the injection or procedure site, and it can kind of interfere with embryo implementation. And you don't want to do anything, especially after paying your money. And even though this is only maybe, like $500 to $1,000 per procedure, that's still a lot of money to be messing around and trying to do things that the doctor told you not to do, and you don't want to mess up any of your chances. But IUI is usually recommended depending on what kind of diagnosis you have. It's recommended for couples that have like unexplained infertility or male factor infertility, because like I said, it's not always the woman that has fertility. Sometimes it's dealing with the men's sperm, and this can offer less invasive and more effective alternative than the ones that I'm going to mention after this. And typically the success rate is around 10 to 20%. I know that does not seem like a high number, but for someone who had 0% chance before, and now that they have this option, I think it's a pretty good percentage up from the percentage that they had. And the pricing, like I said, is about $500 to $1,000 per cycle. So each time you do a cycle, you have to pay that. And they usually suggest IUIs if lifestyle changes or the OI didn't work. I'm moving on to IVF is the next treatment, and I'm not going to deep dive as much into IVF on this video because I'm going to talk about it more on the next video. The next type of treatment that is referred to people depending on their type of disorder is in vitro fertilization, or as you heard me say, IVF. Now, there are two different types of IVF. There's IVF with a fresh embryo transfer, and then there's IVF with a frozen embryo transfer. And some people swear by fresh, some people swear by frozen. I swear by whatever works. And basically for IVF, you take certain medications. People normally take about 3 to 4 shots a day for IVF for a couple of weeks. You take the medicine, and I will go into detail about what those medicines are in the next video, but those medicines basically help to control ovulation and to control the growth of the egg, and making sure that the amount of eggs that you grow at one time is more than usual, so that there's a higher chance when they extract the eggs that they have enough. And once the eggs are retrieved from the ovaries, they collect that sperm. They collect it fresh. The sperm has to be collected fresh. And so you have the egg and the sperm outside of the body. They fertilize it in the lab. Back in the day, they called it test tube babies. Call it what you want. It works. They wait a couple days, and if it becomes the embryo, it's transferred into the uterus. And then I didn't mention in IUI and OI, but you always wait 2 weeks after treatment. After the treatment, you take your pregnancy test, and it will determine whether or not you're pregnant. And IVF in particular is more so for those who have infertility disorders like mine, the dementia ovarian reserve, or women who have fallopian tube damage or no fallopian tubes at all. You don't even need fallopian tubes to do IVF. It could, because they put it right into the uterus. They pass the fallopian tubes. IVF is for people who are experiencing male factor infertility or ovulation disorders, unexplained infertility where the other treatments didn't work. And IVF success varies depending on factors, and also depending on a woman's age. You know, once women reach 35 and older, it's said that it's harder to conceive, harder to have healthy pregnancies, so on and so forth. You know, we've witnessed probably people in our lives before 35 and older who've had healthy, successful pregnancies. They don't advise that you wait to that age, and if you do wait to that age, then you can be considered high risk. The success rate is higher for IVF, and I think it's because of the test tubeness of it. The sperm not having to travel and do all that fighting to get to the egg on its own. It's just put in there. The success rate for women under 35 is around 40% per cycle. It's very expensive. It can be anywhere between $10,000 on the upwards $30,000 per cycle. It can be pretty expensive when it's not covered by insurance, and it's the most commonly pursued treatment that people try because of the percentage of success rates is a little higher, because of the scientificness, that's not a word, but because of the scientifics that's done to complete it. Whatever you and your doctor decide is what's best. I would always say do your research and know your options so that you can bring it to the forefront and say, hey, I know what this is. I know what IUI is. I know what OI is. I know what IVF, fresh transfer, or frozen transfer, and this is why I want to do this. This is what I want to do. You have the right to speak up for what you want. It's your money. So speak up for yourself. I know that along with IVF, they also have ART, which is the Advanced Assisted Reproductive Technologies, and ICSI, which is the sperm injection for those with male infertility, and then the PGT testing, which basically can test for genetic disorders. For instance, let's say there's a family that has Cushing's syndrome or some sort of genetic disorder that can be passed down from family to family to family. They can test for that stuff ahead of time. Now, it is an additional between $1,000 to $5,000 for each additional test that you want to take. Also, honorable mention, I did these things, but I later learned that they weren't as effective as the internet will make you think that they are. But you know, like I said, you try everything whenever you're wanting a baby, and those two things are CoQ10 and the Geritol. People were like, have you tried Geritol? Everybody has opinions when they find out you have infertility and what worked for their cousin, mama, sister, daddy, uncle. There's no large studies or evidence to suggest that CoQ10 and Geritol may have like potential benefits for fertility. I wish there was more. I wish they would look more into things that help with things like fertility, but CoQ10, it doesn't hurt to take it. I took it anyway. I'm gonna tell y'all now, I took it because it's believed to improve egg quality, and for men it's believed to improve sperm health. And since there's not enough evidence to know if it works or not, what do I have to lose? My diminished ovarian reserve is already me dealing with a severely low egg reserve, which means that I had, old eggs left in there. So I'm trying to make my egg, what I have left, as healthy as possible. So I took that CoQ10. Same with the Geritol. It's a multivitamin. It contains iron and other nutrients that can help you support your overall health, but it's not to replace any of the other procedures that I mentioned. For those of you who are looking to possibly move forward and try one of these treatments, as always, do your research on whatever provider, physician, fertility clinic that you use, because all clinics are not the same. Every doctor is not nice or caring. Bedside manner matters. Women, you're going to be on hormones. You need somebody that's going to be understanding and caring. I don't care how many patients they have. You need to have bedside manner. This is important. This is my mental state, my physical state that we're dealing with. I'm gonna need you to get it together. Like I say in other videos, y'all need to go watch my other videos for real. But if they suck, I don't care how far along you are in the treatment. Get another doctor. Don't stick around where you don't feel supported. But I will continue to talk about IVF in particular. I'm so excited about all the things that I have to share with you all about our journey, about our failures, about our success, the things we did in detail. I hope that you like, comment, and subscribe for this video. Ask me questions. If you don't want to comment below, email me. Let's talk about it. I want to start discussions. I want to create this safe space for us. But until next time, bye friends!